Good evening. Here's Wilbert Cook again at Hand Up Recovery Homes. I'm also wearing the t-shirt for my other ministry, Christ Hand Up Ministries. We do the work of trying to help those in the west side of Chicago, throughout Chicagoland area, turn their lives around. By one, helping them recover from alcoholism, substance abuse. Two, helping them build a better quality of life. Three, helping them stop creating more violence and being the perpetuators of violence throughout the community. And that's just a few of the things we do. But we also try to tie people into the other facets of society that help them be more progressive and productive in their life. One of those facets is we have a great relationship with Congressman Danny K. Davis and many of our elected officials. His happens to be the most thorough relationship from start to finish. He's been an advocate for us for the whole 20 years in our existence, going into our 21st year. He's been an advocate for those that we serve, those who are recovered from alcoholism, substance abuse, many of whom are second chance citizens. That means they have criminal backgrounds. And also when it comes to trying to prevent violence, but most importantly, to live healthy, to have good mental health, physical health, and spiritual health. He's been an advocate on all those fronts, not always given the credit he's due, but one of his greatest assistants throughout his 40 years of service is Reverend Paul Jakes, who is his right-hand man, and I mean right hand. He's his godly man, he's his spiritual advisor, but most of all, he's a friend and advocate for the people. And without further ado, since I didn't get the bio before I arrived, because I asked him at a late, but because of his spiritual man in him, he came anyway. And he'll give you his bio. Reverend Jakes, take it away.
Thank you so much. It's a pleasure to be with you today. I've been making most of the stops for Congressman Danny Davis today, and that's simply because Congressman has been in Washington, D.C., and he's been debating, and he's been voting, and they're trying their very best to vote against that big, ugly bill, a bill that would certainly devastate many families in America. At least 80 million people will be devastated by it because the Medicaid is going to be eliminated in the way that we know it today. This week, Congressman Davis had me to organize, along with one of our staff persons, a major ride-through with all of our community hospitals in the 7th Congressional District. We went from Loretto Hospital to West Suburban Hospital, from West Suburban Hospital to Humboldt Health, from Humboldt Health to St. Mary's, and from St. Mary's we ended up at Mount Sinai Hospital. And there, every staff from each group, each administrator came out and spoke, and we had television cameras there, and there were radio stations and newspapers, and they all spoke to us, and Congressman interviewed and spoke out on the need for Medicaid to continue existing, simply because what is Medicaid? Medicaid is a federal state health program that is geared to low-income family persons, and it gives them an opportunity to have health care and to be able to live a quality life without perishing. But the reality is that people will die. People will die without these institutions being around. And so I've been very glad to be supportive to the congressman this week in this effort. And then with all of that going on Monday, we wound up still going to a memorial service, a balloon release for Brad Cummings, one of our very, very good newspaper publishers, and he died, unfortunately, in the fire that is on North Avenue, close to Laramie, and other people died in that building as well, and it's just a sad time for the west side of Chicago.
Yeah, well, it's unfortunate, though, but I ended up in a medical emergency last Thursday due to my cardiologist wanting me to immediately have heart exams. Unfortunately, due to the way healthcare, even when you have good insurance, works, if you wait for the referral system, it could take you 4, 6, 8, 10, 12 weeks to get them same tests. And he felt the only way he needed to know immediately I wasn't having any heart conditions, so he sent me straight to ER, and I missed this programming last week. But now I have a healthy heart. My heart is healthy. Matter of fact, it's functioning a little better than it has in over 10 years, Dr. Jakes. Now, the bad part is 2 major incidents happened, and I have not been able to support the families on. I get in the hospital Friday morning, and I go to the floor, and immediately I get a nurse named Shireen. Shireen's aunt was in Loyola Hospital from that fire. She came to work to get away from all the discussion and mayhem and all the struggle the family's going through. One of her nephews died in that fire. And so I want to send a prayer out and send my concerns out to my CNA when I got admitted Friday morning to Mount Sinai Hospital, that her family be blessed in the spite of the trauma of losing their loved ones. And I'm praying that the aunt in Loyola survives, and the other nephew that was clinging on to life survives, and that family can be restored and repaired as best it can, considering the number of losses to that family. But also Brad's family. I heard about that just before I went to my appointment. Crystal called and let me know Brad had died in that fire before I even saw it on the news, because I was busy, taking care of some other early morning work for the day job. But we also have to work on mental health. We talked about it many times here. Some of this was mental health, emotional health issues. When people create acts of violence, turn around and, from all appearances, set that building on fire. That is a travesty on every level. And innocent people, to my knowledge, almost everyone who died were innocent people, victims of other people's drama, trauma, and so forth, mental health, emotional issues. We have to be more proactive so we can prevent many of these events from occurring, but also that these families and these individuals that are prone to that kind of breakdown, we can lift them up before the breakdown, because the breakdown is traumatic to so many innocent families. And sometimes when people be like, well, it ain't my business, until it comes to your doorstep. Dr. Jakes, I am so happy that you, as the pastor you are, dedicate your life to helping people throughout the city of Chicago, throughout the 7th District, throughout the United States of America. Because what they don't realize is the fight for us is also a national fight, and in many respects an international fight. And I'm glad that when I asked you to say more about you, you went on to talk about the travesty of the big, bad, ugly bill. The travesty of justice in that bill. And I want you to elaborate on what's the approximate number of jobs you all believe have been lost in the last 6-7 months based on policy, not to mention the thousands of people who not working because the federal funding has been tied up to many agencies here and across America, so they can't put people to work to help service people with these mental health issues, these violent issues.
Well, one of the things is that it pays for 60% of all nursing homes. So therefore, we're talking about across the United States, we're talking about people, seniors, people who have disabilities, people that need to recover from accidents or whatever. They are indeed without that care if this big ugly bill passes. It is affecting the workers, the workers would lose, the nurses would lose, the doctors would lose, the janitors would lose, the cooks in the kitchen would lose. It would affect the economic stability of many communities. It is very much a shame that those mothers who are having children, those mothers will also have some problems in terms of the coverage, because it usually covers half of the births that are taking place. The funds in rural hospitals and as a safety net providers, it will be so devastating because people live so far out and hard to get to an institution, hospital institution, and then when it's all gone, it's all gone. And so we are just simply saying that this is now the time to make the phone calls. Now, I have a phone number, and it's never too late because they're still voting on the issue, because our the Democratic leader, who is still on the floor filibustering, is still talking, so we can still reach out and call. Now, Congressman Davis gave me some specific information to share. He said there are 3 Republican individuals, representatives in Illinois that we need to call, and they are Representative Darian LaHood, Representative Mike Bost, and Representative Mary Miller. The telephone number for the representatives is a number. All you have to do is ask for those individuals. It's area code 202-224-3121. Again, that's area code 202-224-3121, and ask for Representative Darian LaHood, Representative Mike Bost, and Representative Mary Miller, and just simply say, do not vote for the big, ugly bill. And that would send a loud, resounding message that we are indeed standing up and doing our very best. And I'm very appreciative to all the ministers that we talked to today and met with, that those ministers took their cell phones out right then and there and called area code 202-224-3121. And I believe that it's now time for you to do the same. We've got a little time left, but there's still a marathon session, and they're still fighting to keep Medicaid available for you, and you.
All right, thank you. And I mean, it's a travesty that this bill is going to have a ripple effect, especially on poor people. Because when poor people, middle-class people lose their job, they fall into the poverty-stricken class. And it doesn't take long, a paycheck or two, and bam, everything starts to snowball. And when desperate people do desperate things, it is a known fact that whenever unemployment increases, 2 things happen. There's an increase in addiction and an increase in violence.
Excellent.
And that is because of crime.
Absolutely.
So desperate people do desperate things. And the sad part is poor people implode on each other. Mm-hmm. You're not in the proximity if you can't pay the car note and they repossessed it to get to other communities to lash out. So what you do is you lash out in your immediate surroundings. You rip off the people in your immediate surroundings. You start to get shot at or be shot by people in your immediate surroundings. This is a crucial life and death matter, not just on the medical side before the trauma, But the ripple effect of violence, drug addiction, alcoholism that precedes people losing their jobs. And I bet if we took a poll now from January when people started losing their jobs all over the government to right now, it's probably a 25-30% increase of alcoholism and addiction because those people are in the trauma and people try to medicate themselves. They can't afford it. They lost their jobs. They do not have their insurance anymore to pay for legal drugs. So the street drugs become available and alcohol is always available. Therefore, we have a perpetuation of negative cycles to poor people and those struggling to come out from under the weight of this travesty. Please, people, let's be proactive. Let's stand up for what's right for working class people, poor people trying to get into the working class, middle class people trying not to fall back into poverty, but to move up to the upper middle class and help pull people up. You can't pull people up when you stuck at the bottom yourself. And Reverend Jakes, any other things you want to add to that?
Well, yes. Well, recidivism is a serious problem with going back into jail or back into drugs. And we have to do everything we can in order to help people to get out of that. Might I also mention that Congressman Davis is also a PhD. He's a psychologist. And he's looking at things from all different sides. And on July the 11th, there's going to be a meeting. It's a meeting that clergy are asked to be at, but it's also a meeting that we say to regular citizens, you're welcome. It's going to be at Friendship Baptist Church, 5200 West Jackson Boulevard. Breakfast is going to be served at 9:30 a.m. and the meeting will start at 10. That's at the Friendship Baptist Church, where Reverend Backus is the pastor, 5200 West Jackson, July the 11th. Breakfast is at 9:30, no charge, but we would like you to come and be a part of it and to be able to hear Congressman give a report on all these various things. Of course, today I am so glad to announce that Congressman Davis received an award from Benny Lee and from the state representative of our area, LaShawn Ford, and many others who have shown their support for the Second Chance Act that Congressman Davis has dealt with. Everybody deserves a second chance. Everybody deserves an opportunity to get their lives right. And so today has been a full day. I'm glad that I could make it to all of these meetings today, and I tell you, the best is yet to come.
Definitely glad to hear that. And yes, again, the property tax form, where you will learn about how to get your tax exemptions, how to appeal the value that's been put on your property last year in the city of Chicago, which you will feel the impact on that second installment bill that's coming. For someone who's been blessed to work with the tax system for almost 28 years, come October 14th, the reality is that we don't know enough about all the exemptions. There are exemptions for these things: a homeowner's exemption for those who own a home as of January 1 of a tax year. There's a senior exemption for those 65 and older. There's a senior freeze for those 65 and older with household income less than $65,000 a year. There are homeowners exemptions when you're getting work, permit work, not the handyman, even though we like to keep them employed. But if you get a permit pulled on some work, you can get up to $75,000 worth of that work. I think it's probably even a little bit more than that now. Deferred 4 years before the value impacts your current value of your home. Then you have the opportunity, when we put a value on it, new values, and like where I'm at, finally went down after 2007 to 2008 market crash in the real estate industry. My property taxes finally went down last tax cycle. But then last year, a building sold for $400,000 on my block. where we used to have 18-hour-a-day drug markets. Now we have a little Pee Wee Herman type drug thing going on. But they not up and down the whole block 18 hours a day. We don't get, I think they got working schedules now. They 8 to 5 or 8 to 6. But they let me stop it. And they on one corner, they not on every corner and all over the block. And we're trying to get them back off that corner. However, even when you can be in the midst of what they call the heroin highway, all the deaths, murders, ODs that happen within a half a block of my house, and one of the, quote, worst CTA train stops in Chicago, we have houses selling now for $450,000, $480,000, and then we have little small houses, not even a good 1,200 square feet, that's selling for $200,000 and $220,000. When you have that much happening, what happens is everybody's values go up. But when you have did no work, because those have been renovated, when you have did no work, you have to fight and let them know, I have not renovated my home. Or sometimes you change in the deed, and what happens is they don't know it's not a sale. Mm-hmm. So it looks like it could be a sale. So you lose your exemption. So these just a few ways you need to be at the property tax exemption. There's exemptions for veterans, for disabled, and there's full disability. And then through the state, for many veterans, there is a total exemption on property taxes. So you got to find out about these programs that help you when you own a home, especially at the rate people losing their jobs from the federal government, going to lose their job from private industry, going to lose their job in the Medicaid, Medicare system as these changes take effect. And those that have lost the job and have a contract stall because federal funding they used to get, they can't even apply for since January 23rd. Most websites for the federal government to give grants to all these community groups from the federal government have been shut down till further notice. Unless it involves law enforcement, most likely it is not available. And you know, most law enforcement not controlled by our people. Not at the top, not at the grant level. So those are things you need to know. But back to property taxes, those people who unfortunately are going in the unemployment line at unbelievable rates need to know whatever tax savings they can get to hold off and save their home as long as they can till we can get back to some normalcy and restore people's jobs, as well as create more jobs in the private industry for the rest of our community. Thank you, Dr. Jakes. You want to wrap up? You got about 2.5 more minutes.
It's July the 11th at Friendship Baptist Church, 5200 West Jackson Boulevard. 9:30 a.m. is breakfast, 10 o'clock is a meeting. So this is important. I mean, I tell you, I didn't know that Reverend Wilbert Cook had all that knowledge. But my goodness, you got to come and you've got to get this information to help your church, to help your home, to help your community.
All right. And with that, we got a couple more minutes. Anything else you'd like to talk about? Dr. Jakes, is there anything else going on? Any more press conferences? Because you know what's peculiar? I'm sitting on the table to take an angiograph. That is to see if I got any blockages in my arteries to my heart. Mm-hmm. And they're announcing that around 2:15 in the afternoon, they want all the hospital staff that's available and not busy to head out front for the press conference with Congressman Danny K. Davis. They ready to make sure I got a sound heart.
Yeah.
And I wanted my heart, mentally, emotionally, wants to be out, spiritually wants to be out there with Congressman.
Yeah.
But I got to take care of my physical heart and make sure it's all right. And I'm sitting there being prepped to go in for Mount Sinai.
You were at
Mount Sinai Monday when you all were out doing the press conference outside. I'm inside down in the dungeon. I mean the rehab basement in the cardiology department.
Yeah, we would have came in there and prayed with you with the TV cameras and everything.
Yeah, I bet. They've really been mad. They gave me such poor service. Yeah. But I understand all the cuts and everything. But that just show you how people you know who are trying to help the community, save the community. And the unfortunate part is Mount Sinai is going to be hit tremendously because they depend on the federal grants and Medicare, Medicaid systems to take care of hundreds of thousands of people.
And emergency room.
And emergency
too.
room,
That's
right. The
That's
emergency room trauma care, those with heart attacks, those with strokes, those with blood clots, those with gunshot wounds, stab wounds, seriously beaten half to death, because that was an incident while I was in the emergency room. A kid was beaten almost half to death right there at Polk and Independence. And his family was deciding, and there was some other family dynamics going on. And to keep him safe, they was about to get him committed to a mental health institution for his own good, because of his own bad behavior, and because he had all been beaten so much that they felt it was safer to put him in the hospital there and let him regroup, get over his own anger for what happened to him before he go out there. And then we got a whole nother set of violence going on, and we could end up with more young folks' lives destroyed. And so we need to stay in prayer, but we also need to stay positive, and we need to keep working to help improve the quality of life in our communities.
Thank you so much for this opportunity to be able to share. And certainly people that need more information, they can always call Congressman Davis' office at 773-533-7520. And thank you so much. And those are the people of faith. Would you please pray today that we can keep Medicare, Medicaid, keep Social Security, and other programs that are necessary for lives to be saved.
Thank you.
Thank you.